Today, our topic of discussion is about cleaning and shaping of root canal system, and in specific, the step back technique for cleaning and shaping. Coming to the introduction, endodontic treatment mainly consists of 3 steps: cleaning and shaping of the root canal system, disinfection, and obturation. What is cleaning and shaping? Cleaning, it comprises the removal of all potentially pathogenic contents from the root canal system, and shaping, it is establishment of specifically shaped cavity which performs the dual role of 3-dimensional access into the canal, creating an apical preparation which will permit the final obturation of the instruments which will easily fit. What are the objectives of root canal preparation as given by Schilder? Mechanical objectives, biological objectives, and clinical objectives. The mechanical objectives as given by Schilder include that there should be a root canal preparation that should be continuously tapering cone, making the preparation in multiple plane, which introduces the concept of flow, making the canal narrow apically and widest coronally, and avoid the transportation of foramen. Keep all apical opening as small as possible. Coming to the biological objectives, procedure should be confined to the root canal space. All infected pulp tissue, bacteria, and their byproducts should be removed from the root canal. Necrotic debris should not be forced periapically. Sufficient space for intracanal medicaments and irrigants should be created. The clinical objectives of biomechanical preparation include that removal of overlying dentin causes smooth internal walls and provides straight line access to the root canals. After obturation, there should be complete sealing of the pulp chamber and access cavity so as to prevent microleakage. Tooth should be restored with a permanent restoration to maintain its form, function, and aesthetics, and patient should be recalled on a regular basis for evaluation. Removal of overlying dentin causes smooth internal walls and provides straight line access to the root canals. Instruments used for radicular preparation includes hand instruments, which includes broaches and files, rotary instruments, which includes Gates Glidden drills, pro taper files, profile files, grated taper rotary files, Quantec file series, light speed instruments, K3 files, and Hero 642 shapers and files. The automated sonic and ultrasonic instruments are also used for radicular preparation. So are lasers. The different movements of endodontic instruments include push and pull motion, reaming, turn and pull motion, watch winding motion, and balanced force technique. Reaming action is a repeated clockwise rotation of the instrument, which will shave the canal walls and give a cross-section preparation approximately round. Reamers are usually more effective for this function. Filing action, it is a push-pull action without rotation, which has a great efficiency with files than reamers. The cross-sectional appearance of a prepared root canal is irregular with general oval configuration. The combination of reaming and filing. In this technique, file is inserted with a quarter turn, clockwise rotated, and apically directed pressure, and then is subsequently withdrawn. Balanced force technique was introduced by Rowan and Sabala, in which a file is inserted in a clockwise 60-degree as denoted in the diagram, apical pushing with a rotation of 120-degree counterclockwise rotation, and removal by giving a 60-degree rotation clockwise. Watch winding motion, it is an arched arrow in the diagram indicates a general right and left rocking motion which causes the instrument to cut while a light inward pressure keeps the file engaged and progressing towards the apex. The arc of rotation is indicated by the shaded region in the circle, which is 30 degrees away. Watch winding and pull motion. The watch winding and pull motion is used primarily with headstrom or hedge files Inward pressure is maintained while the file is gently rocked right and left through the arc indicated by shaded region of the circle. When insertion stops, all rotation is ceased and the instrument is withdrawn with a pull motion. The motions of instruments for cleaning and shaping. There are 6 unique motions of files and reamers used in serial shaping. They are follow, follow withdraw, cart, carve, smooth, and patency. In follow, the file is pre-curved to follow the canal curvatures. In follow withdraw, in and out motion is given to the instrument. It is done to create a path for the foramen. In cart, carting actually means transporting, refers to the extension of a reamer to or near the radiographic terminus. The pre-curved reamer should gently and randomly touch the dentinal walls at the radiographic construction and cart away dentinal debris and pulpal remnants. Carve is for shaping. The key is not to press the instrument apically, but simply snuggle into the dentin with a pre-curved reamer and shape on withdrawal. Smoothing is circumferential filing. It is usually accomplished with files. Patency, it is achieved with files or reamers. It means simply that the portal of exit has been cleared of any debris in the path. The basic principles of instrumentation are henceforth: there should be straight line access to the root canal system. Copious irrigation should be done in between instrumentation. Prepared canal should retain its original form and shape. Exploration of the orifice should be done with smaller file to gauge the canal size and configuration. Canal enlargement should be done using instruments in a sequential order. Flutes should be cleaned and inspected after each removal. Never force the instrument in the canal. Recapitulation is regularly done to loosen the debris. Over preparation and too aggressive over enlargement of the canal which are curved should be avoided. Overusing of the larger files must be avoided as it may result in further enlargement of the apical opening. Coming to the techniques of root canal preparation, 2 approaches for biomechanical preparations are there: apical to the coronal technique and coronal to the apical technique. The various techniques have been modified out of these 2 basic techniques. In apical to coronal technique, basically 4 techniques are there: standardized technique of canal preparation, step back preparation, modified step back technique, passive step back technique. In coronal to apical preparation, the following techniques are there: step down technique, crown down pressureless technique, hybrid technique of canal preparation, balanced force technique, reverse balanced force preparation, double flaring technique, modified double flare technique. The standardized preparation technique was by Engel. Determination of working length is done. Select initial apical file size. Circumferential filing is done to increase apical construction 2 to 3 files greater size. Increased incidence of ledging, zipping, and perforation is seen in the standardized preparation technique. The work as seen in the diagrams, working length is first determined. The smallest reamer is introduced and successfully large reamers are introduced. Coming to the main portion, that is the step back technique. It is also known as telescopic canal preparation or serial root canal preparation. It emphasizes on keeping apical preparation small in original position and keeping and producing a gradual taper coronally. The preparation is done in 2 phases. Phase 1, preparation of the apical construction. Phase 2, preparation of the remaining canal. In step back technique or phase 1, first evaluate the tooth for decay, which causes the pulpal exposure. Prepare the access cavity as shown in the diagram and locate the canal orifice. Further, determination of working length is done. First, instrument is inserted with watch finding motion with gentle clockwise and anti-clockwise motion of the file. Then it is removed and the instrument is removed and irrigation is done. Recapitulation is done further using smaller file to break up the apical debris and repeat the process until a size 25K file reaches the working length. In phase 2, next file is placed 1 mm short of the working length. Do watch finding motion, circumferential filing, irrigation, and recapitulation. The above steps with the larger files are done at 1 mm increment short from the previously used file. Finally, a root canal master apical file is used to refine the walls of the cavity. A 30 number file is used 1 millimeter short of the apex. 35 number file is used 2 millimeter short of the apex, and 40 number file is used 3 millimeter short of the working length. As seen in the diagram, a 45 number file is used 4 millimeter short of the working length, and a 50 millimeter file is used for canal preparation. Step-back preparation creates a small apical preparation with larger instruments used at successively decreasing lengths to create a taper. Coming to the advantages and disadvantages of step-back preparation, advantages are that more flare is given at the coronal part of the root canal with proper apical stop. Disadvantages include difficult to irrigate the apical region, chances of pushing debris apically. Step-back preparation is time consuming. Iatrogenic errors like ledge formation in the curved canals may occur. Difficult to penetrate instruments in the canal. More chances of instrument fracture is also noted as seen in the diagram. Passive step-back technique was introduced by Torabinajad in the year 1994. It is a combination of rotary and hand instruments for root canal preparation. Passive enlargement of the root canal, apical to coronal portion is done in passive step-back technique. The advantages of passive step-back techniques are that it provides significantly cleaner canals, less chance of transportation, ease of clinical application, applicable in every canal type. In crown down technique, the dentist prepares a canal from crown to the tooth. Morgan and Montgomery found that crown down pressureless technique resulted in rounder canal shape when compared to step-back technique. Early coronal flaring with gate-ridden burrs are done in crown down technique. Incremental removal of dentin from coronal to the apical direction is done. Straight K-type files are used in large to small frequency with a reaming motion and no apical pressure. Following are the steps of crown down technique. Straight line access to the root canal system is obtained. Access cavity is filled with irrigant. Pre-flaring of the coronal third of the canal is done using gauge clearance drill. Larger file and then smaller file circumferentially is used. One disadvantage of crown down technique is that excessive use of gauge clearance drill at the same level leads to excessive cutting of dentin and weakening of root, and thereby produce a Coke bottle appearance in the radiograph as shown in the diagram. Further, establishing of the working length done after the coronal enlargement with smaller instrument after irrigation and recapitulation. Use of larger file is done to prepare the coronal third. Preparation of the canal at the middle third with subsequently smaller files is done. Apical preparation of the canal with frequent irrigation of the canal system is also done. Thus, a well-prepared and tapered preparation of tooth is obtained using a crown down technique.